Hi, and welcome to Animas Conversations. Today I'll be talking with Pete White, the author of From the Bottom of the Barrel, even. That was written in 2019. Today, myself and Pete are going to be exploring mental health and coaching. But before we sort of dive into the depths of it, let's allow Pete, first of all, to introduce himself. Hey, Pete.
Hi there, how are you doing?
I'm good. How are you?
I'm doing really good, thanks. Yeah. Thanks for having us. I appreciate it.
Yeah, you're more than welcome. It's a pleasure to talk with you. Could you just maybe share a little bit about your background and how you sort of came to be working with mental health, and then we'll start to sort of link that to the coaching world.
Yeah, of course. So my background originally, I was in the Air Force for about 9 years, and I was deployed to Afghanistan in 2011. So while I was over there, I worked in casualty reporting. So that meant I was privy regularly to kind of some of the let's say, not so pleasant aspects of warfare. And basically, I did that particular job for 10 weeks. And at the time, I had no support. I had nobody to speak to, to kind of just vent off to what I was witnessing. And that had quite a profound impact on my mental health. So things kind of, I'll start that again. Things kind of deteriorated, that's the one, after that. And eventually I was diagnosed with severe depression and post-traumatic stress disorder. At one point, I was even so poorly that I actually experienced psychotic episodes where I basically lost touch with what was reality. It took quite a lot of kind of treatment, various medications, a lot of support from the guys around me, like certainly my wife, and a lot of work with myself. And that's where kind of coaching came into that, where I discovered life coaching, got a coach myself, and fell in love with it. And so then I trained with Animas. At the same time, I was still kind of recovering. And then I kind of found myself in this space where I was like, I love coaching. I love helping people with mental health using my experiences, and how can that look? And almost by accident, just because I was quite open about my experiences, I was happy to tell people and stuff, that, people would come to me and would get in conversations, and it almost just naturally grew into kind of a coaching niche for me from there in terms of discussing mental health with clients and stuff. And that's kind of how it was born. These days, I've moved a little bit away from the coaching side. I still do some of it, but I do a lot more consulting work and training work with organizations to basically help them put systems in place to support their employees with their mental health. And I love it. It's probably the best job in the world.
Fabulous. And I really liked what you were saying there. You were saying, in coaching where you are discussing mental health. And I think both you and I guess a lot of people that are listening who've often heard people talking, or coaches maybe in supervision saying, they've got a client and this is what's going on for them. And we sort of get that feeling of, well, should you be coaching that person? Is that the right forum, the right place, or should something else be at play? And I guess where we sort of began this conversation was, well, how do we talk about this in our coaching without working on it, so that we're able to keep both the client okay and ourselves okay within that environment?
Yeah, so that's a fantastic question. I think the first thing I would say is we need to be aware of mental health as coaches, but we shouldn't fear it. And I think that's really important to point out. And if we start maybe identifying that there could be some kind of mental health issue at play here, it's not a case of going, whoa, I can't touch this, we can't do this anymore. But maybe to kind of facilitate it in a way where the client's able to explore their feelings and their thoughts, but we're not actually attempting to treat the condition. I think that's really key to point out, is that we're not looking to diagnose or prescribe or treat. It's giving the client space to explore what's going on for them. They may not even want to or be looking to discuss mental health, and that's fine. That could be very much on the sideline, and we look at other things as coaches. But I think that's really key, is to know when to know when something might be going on, to identify that, and then be willing to explore that with the client if they want to.
And that's a really good point there, that we're not there to diagnose something, and we're not there to run away from something. But as coaches, there is an awareness that we need to to have so that we can begin to go, is there something at play here that
Yeah.
may sit outside the boundaries of my skills as a coach? And I'm just curious, Peter, what would be for you, and I recognize that each person would be different, but what might be an indication that something else might be at play here?
So, I mean, I think there we're kind of looking at these signs and symptoms around mental health, and that's a very, very broad subject. But certainly, somebody who's got a continual, very negative outlook on the world, or maybe on themselves. So there might be discussion of things about being a burden on people, or they might be talking about feeling hopeless or helpless. And I think certainly down the far end of the spectrum, but it still happens, is somebody who might be almost losing touch with their concept of reality. And certainly that's what was happening with me, where I was actually kind of inventing my own reality, my own truths, and they were absolutely true for me, some of these beliefs that I held. But then if I did discuss it with people around me, they'd be kind of saying, Pete, that isn't what's happening here. So I think just to kind of identify what the client is saying, and also in some ways what they're not saying. And I know we do talk about this in the Animas training, where sometimes a client might be talking and say, oh no, actually it doesn't matter, and they'll move on to something else. And there's something there where they might feel maybe embarrassed or ashamed or just scared of it, because mental illness, I'm not going to lie, is quite a scary thing. And certainly if they don't really know what's going on, they might quickly say, forget about that. So then we might say, okay, well, no, what is it around that you feel unsure about? If they don't want to talk about it, that's absolutely fine. But it's giving them that space to say, what was it about that kind of stopped you there? Something else I think is really important to point out is that obviously we're there to be there for the client, but it's really important as coaches to look after our own self-care as well. And if you do choose to explore mental health with a client, it's really important to stress that you need to look after yourself. You need to take time out to maybe absorb and process what you've spoken about, and certainly have somebody there to support you yourself, whether that's a coach or even a therapist, or just somebody where you can kind of sit with what was spoken about and almost explore it yourself. Because mental health, when dealing with it as an outsider, is quite exhausting. It's quite emotionally demanding. And I think that's really important that we pointed out.
I think this is where you start to get into the realms of supervision and how important supervision is in the coaching world. And I imagine that a supervisor would also help a coach to pick up when mental health challenges might be at play within their coaching as well. So I guess this is something that's really important, that having supervision as a coach as well as having it for that support, but also having it there to help you identify what might be going on. And you were saying there that it's exhausting. Could you give me a little bit of an idea as to what sort of might be happening in a session that creates that exhaustion, I guess?
Yeah, so what I would say is that it's quite normal to feel a lot of pressure, because as coaches, we tend to care for our clients to some degree. And if we feel like they're in some kind of distress, that can be quite emotionally demanding on us. And there's that. I mean, certainly, talking is, when I was a new coach, there's that sense of, oh my God, what do I say? Even in any normal coaching session when you're first starting out. But that's even more so when it comes to mental health, because, you're really aware of maybe saying the wrong thing. And then when you start looking at some of the more kind of critical areas of mental health, if somebody maybe is questioning their place on the earth, and that does happen. I've dealt with a few times now where I've actually dealt with kind of potential or imminent suicides, and I can really tell you that is so exhausting, because I think the brain just almost goes into overdrive, and you're trying to think of what you should do, what you shouldn't do, what you should be saying, what needs to happen to get this person safe, and hopefully to anybody listening, this won't happen, but I think it's important to put it out there that it could. And to kind of maybe equip yourselves with that awareness and those skills would be really important and could genuinely save a life.
And we were saying there that as coaches, this often doesn't really appear in the coaching space, and that we shouldn't be afraid of it. I know when I first started coaching, you know, what was it now? I don't know, 13, 14 years ago, that, you know, somebody said to me mental health might come up in the coaching space. I'd have been terrified as a new coach. And now as a much more experienced coach, I feel much more able to sit with that and to explore something with somebody that's kind of sitting on the edges, and to explore with them where they might want to take that. So as a new coach, I guess we're saying, you know, don't panic, find the right support. And I guess what would be your sort of, I don't really want to give the top 10 tips around this, but what would be an idea for you around if you notice something in the space, what might be some of the classic things that one might do as a coach?
Yeah. So there's a few things kind of jump out. One thing certainly, as somebody who may be new to suffering from some kind of mental health issue or may not be aware, is you can explore their options for support. So obviously we can't provide therapeutic support, but we can help them explore options to maybe get some kind of therapeutic support, or even just to speak to the doctor. You know, there's various signposts we can go down, everything from GP to speak to somebody like Mind, to the therapy in the NHS, that kind of thing. And something I've done in the past is to say to people, okay, so, you know, from this point forwards, what could we do? What are the options? And I've even thrown out something stupid out there where if the client has been a bit stuck and said, well, I don't know, I said, okay, well, you could go watch The Simpsons after this. You could do that, but would it be beneficial? You know, would that help in the long run? And just by giving that, even if it's a silly suggestion like that, kind of just kicks something in emotion. Also, just allow the person to express their feelings and their thoughts, and just be present with them, really listen to them. Because one of the best things you can do when you're discussing mental health with a person is just to listen. Because so many people don't want advice, they don't want to be led or directed, they just want to be listened to, and just for their emotions, their feelings to be validated. And I think when you give somebody that space, it can be incredibly powerful without us even having to say a word sometimes. There's a couple more things, like I've discussed creating a care plan with clients. So that's basically a list of things that are beneficial to you on an individual basis, that you can use, even if your health is good and it just maintains your state of mental health, or you can call on it if your mental health isn't that good. And I've got a care plan myself, and I swear it's kept me from relapsing for about 4 years now. It's a really, really powerful tool, so you can explore that with them. And lastly, one of the key kind of trigger risk factors around mental health is certain kind of lifestyle circumstances or changes, you know, maybe decisions that someone has made in their life which has led them down a certain path. And certainly as coaches, we can and often do explore how somebody could maybe make a change to an aspect or multiple aspects of their lifestyle, which actually has quite a significant impact on their mental state. And that isn't therapy. That is just, you know, exploring options with people. There is a kind of quite a I can't say this word, specific niche of coaching, and it's called CBT coaching. And if anybody who doesn't know it, that is a cognitive behavioral therapy, which is a form of therapy in itself. And this type of coaching does require a certain qualification as well, which is important to stress that. But that actually allows them, the coach, to bring in elements of therapy and elements of coaching, and you combine that together, and it's a powerhouse of coaching. It really is. And that, you know, if someone's interested in this avenue, that is something that could explore. Or if not, they could, you know, help the client look for somebody who is able to provide that type of service, to make sure that they are getting the best service.
So you, as I said sort of in the introduction, that you wrote that book, From the Bottom of the Barrel, and I know that you've been on a journey yourself. And if it's okay with you, I'd really like to hear a little bit about sort of what were the things along that journey that allowed you to turn things around.
Yeah, wow. Okay, so I think for me, I remember one time I was sat by my bed, and I was very, very close to ending my life, and I was actually having a panic attack at the time, and my head was just swimming. If anybody's ever had a panic attack, you'll kind of be able to to recognize that it feels like it's impending doom. And I remember sitting there and I was trying to just make sense of everything. And then it just, I almost had a moment of clarity, and I just said to myself, I've got to make a choice right now. I either need to do this thing I'm considering, or I need to make a choice to fight and work out how I'm going to do this. And for me, that was one of the biggest turning points. The other thing was when I was eventually diagnosed with PTSD. So it was for me, it was depression first, and then the PTSD diagnosis came after. And they put me through certain trauma therapies, and then I started doing CBT therapies. And then that's a part of CBT, is to help a person realize that you have control of your own life, and your choices will, directly impact how your life turns out. And that's kind of when I realized that is absolutely true. And I'd been living for 7 years with this state of mind of, well, I can't be helped. I'm beyond any kind of help, and this is it. I'll always be suffering. And I kind of just said, no, there is options out there. And for me, that was a turning point when I started to come out the other side of it, and I decided to write my book. Originally, I didn't start to write it to be published. I wrote it because I was just coming out of this huge chapter in my life, and I wanted to document it. And also, part of PTSD for a lot of people is to lose some aspects of memory, and it's not even just the traumatic stuff, but general, childhood memories in some cases. So I kind of wrote all this down, and then I was telling friends about it, and they were like, "Pete, I would love to read that." So okay, there you go. And all of a sudden, it became, it was published and it became a thing. And I found that kind of very therapeutic, and getting feedback now, even over a year later, I'll get random emails from people saying, "Oh, I've read your book, I love it," and it's, I've realised that I do need to get some support and this kind of thing. And that to me is better than any amount of money in the world. It's so powerful.
And it's that there's something there about you sharing your story that enables other people to recognize the journey that they're on, and therefore how they might need to seek help and support. And there was something really interesting there when you said, by getting that diagnosis allowed you then to begin to take steps forward. And I guess that part of what we might do as coaches is to help our clients think about, if not explore, what might be going on for them and what's the help that they might need in order to really understand what's happening.
Yeah, absolutely. I think for in terms of the diagnosis aspects, what's really important to point out is getting that diagnosis isn't easy. It's not nice, to be told you're suffering from depression or PTSD or anxiety or OCD. But what people need to realize is that you are so much more than just that label. You are not your condition. It doesn't own you. And you are able to move past that and grow from it. But also, to be told, this is why you're having these thoughts and these feelings and you're acting this way. It's a bit of a light bulb moment. You're like, oh, right, that makes sense. And you can start your own little research as well and say, oh, yeah, I recognize that, I recognize that. But to be able to sit down with a client and kind of help them explore their thoughts and their feelings around that. And maybe if a client might feel a bit resistant towards coaching, certainly as coaches, we can say, okay, so what is it around that you're feeling resistant to? Can you tell me about some of those thoughts you've got? Because a lot of people make assumptions about coaching, which are not necessarily true and might prevent them from getting that support.
And I guess if there's a label attached to something and we're afraid of the label, then that's going to make us avoid not only coaching, but avoid therapy, avoid talking about it. And I think there's something really powerful about sharing with people that you are more than that label. You go beyond that. That's just a part of you, or just a description of an element, but that is not the whole self.
Yeah.
And I'm just curious about, when you think about yourself and that label that you had for that time, how was that? Were you able in that moment to go, but I'm more than this? Or was that something that came later on for you?
I think for me, the sense that I'm more than this did come later on for me, but the sense of, I'm not going to just curl up and give up. I can't fight this. But it's kind of a realization that mental illness is treatable no matter what the condition. Now, that isn't to say that every condition can be 100% recovered from, but it is possible to go into remission and live a totally normal life. And with some conditions, certainly like PTSD, OCD, and even schizophrenia, there's a lot of stigma around those conditions, which might prevent somebody from speaking to the doctor or therapist or saying anything to anybody. And that stigma genuinely can be even more harmful than the condition itself. And I think there was a stat from a 2016 study that said 70% of people who are suffering from mental health issues will not receive support. And a big part of the reason behind that is the stigma. So as a coach, being able to facilitate that person to explore that and just get those feelings out without judgment, and with being kind of a confidential space within the boundaries of safety, of course, kind of really can help towards that stigma, because being able to giving yourself the permission to talk about that and almost feeling the permission from somebody else to be able to talk about that is so powerful, and genuinely has and will continue to save lives, because the stigma stops you from doing that. And without that, you're not going to get the support, and recovery will be very difficult, if not impossible.
And so what is it so you did, you went through your experience, you then started doing coaching, and that kind of fused with what you were doing. Was there any sort of model or style that you could kind of label or talk about that came from the fusing of that work?
Model or style? It's a really interesting question. I think for me, it's not even a model as such, but when I went through Animas, one of the biggest module that we did, and that resonated with me, was presence, and just the ability to be with, and just to put it's a really nice thing to say, but just to shut up and just to allow the person to just talk to you and explore their own feelings. That was so powerful, and that is really what is so powerful when it comes to mental health as well. And I think for me, that's what I employed so much of. And I've had sessions with clients where for the entire coaching hour, I've barely said a word, and they've just spoke. And at the end of it, they said, "Pete, that was amazing. Thank you so much. I didn't do anything, but you're welcome."
Well, I guess you were holding that space,
yeah.
and enabling that person to express themselves in that space, which often, as a new coach, one often feels that we need to be doing stuff. We need to be active within the coaching space, as opposed to holding that space and allowing somebody to explore and express. And I know that in that presence module, it's very much about, being present with that person, meeting that person where they are, and allowing them the space to express without trying to get in there ourselves.
Yes.
But, stay fully out of it, out of the stuff, but present to what the person is experiencing, and allowing the person to experience it very much in their here and now.
Yeah. I think for me, there's two things which have been especially useful, and that is the use of silence. And I know we do cover that on Animas, and I really encourage anybody out there to practice the use of silence, because it is so incredibly powerful. And what I tend to say to people now when I'm training in the corporate sector, and I do use coaching techniques when I'm training, is to watch a person's eyes. If their eyes are kind of floating around like this, just don't say anything, just wait. And then if they do look you in the eyes, that's maybe when they're looking for a reply. And that itself has been so powerful. The other thing is a practice, which it isn't mine, I didn't invent it, but it's called brain dumping. And it's just to get everything that's going on in your mind down on paper. And I would recommend using paper for this rather than a computer. And I've done that with clients, certainly before a session, got everything down in there. And then they can literally see what's going on, and they can start to explore it. Whereas if it's all up there, it's generally a bit muddled. And certainly with mental health, and definitely depression, it's the way I describe that is it's a bit like there's a storm in someone's mind, just blowing all the thoughts all around, and you can't make sense of it. So by doing that can be very, very powerful, where they can start to explore that stuff.
Yeah, it reminds me of the work of Michael White, where I think it's Michael White, he talks about externalizing the story. So
Yes.
instead of having it contained in the mind, by talking about it, by vocalizing, we start to take it out of ourselves, and then it's something that we can look at and we can explore. And that, you know, then goes into the work of David Drake about, you know, what's the narrative that's here, what's the characters
Yeah.
that are playing out within this story, and what are the changes might we want to make to this narrative, or how might we want to reauthor this story that's at play. And I guess
Yeah.
we're kind of talking about similar things here, which I always find incredibly fascinating, how the different ways of working kind of coalesce, merge, and then diverge again.
Yeah, absolutely. Yeah. I think when it comes to mental health and coaching, I always see as kind of therapy and coaching is there's this kind of blend in the middle there, where therapy is a lot more about looking maybe at the past and what has happened and processing that. Coaching is a lot more about looking into the future. Don't get me wrong, there's elements of therapy that do look into the future as well. But then there's kind of a meeting in the present, where I think therapy and coaching, if done right, can be hugely beneficial if there's kind of a combination of, whether that's a therapist and a coach, or a coach therapist, and it can be so beneficial to do that.
So now a lot of the work that you do is working with organizations, exploring the mental health in the workplace. And I'm imagining that sometimes that it can be difficult to actually get organizations to think about mental health in the workplace. How do you go about doing that bit?
Honestly, when it comes to business, a lot of it is about money. And as much as we might not think that's the case, it is. So I do a lot of work when I sit down with execs and kind of HR type of people. And I'll say, look, if this study here shows that if you invest X amount, you will literally make 6 times what you invest. And I was consulting with somebody yesterday from a job, and I basically said, look, if you've got an organization of 500 people, if you invest £90 a person, which is I think it's about 40 grand or something, you will make about £370,000 back. And that's when they start going, oh, okay. But there's also, I'll try to put a big human element on there, because the business money sense, yeah, absolutely, it's a thing, we need to accept that. But a lot of managers genuinely do care about their employees. And so if I were to say something to them, where if I said, I don't know, if one of your employees was suicidal, what would you do? And you often kind of met with this blank look of, I don't know. Okay, let's talk, shall we? Because that's when it kind of dawns them that this happens. Unfortunately, it does happen, and that there needs to be systems in place. I think something else that really works for me is when I get to tell my story, because it puts a human face on the subject of mental health. It can be quite kind of impactful, and I genuinely consider myself very lucky that I'm able to do that. That, you know, I went through this horrific period of my life, but I can use it to help people and say to people, look, this is a real thing. We need to be doing something about this.
Brilliant. And you talked earlier on about something, and I wanted to ask you what the components of that were. And I didn't, and now I can't quite remember exactly what it was. You said there was was it a care package or a
care plan? Yes.
Care plan. Yeah. So tell me a little bit about what were the components of a care plan?
Yeah, so I mean, the way a care plan can look, it can be purely individual. I teach one method of doing it. Feel free to change as much as you want, but mine has 3 tiers. So tier 1, 2, and 3. Now, tier 1 is all about using yourself in your own space to do things that help you, so nobody else is in the picture. So if you know, for people who are maybe isolated and locked down, which is pretty much all of us right now, this can be really useful. And for me, that might be, I don't know, let's say we're in a non-COVID period, that might be going to the cinema, or going for sitting of coffee, or giving to charity, or maybe meditating or reading, just things that are me. And I will literally start at the very top of that list. Maybe on mine that is going for a run, and then I work my way down the list one by one. More often than not, that will effectively catch me as I'm falling, and that helps. If not, I go on to tier 2, whereas that is bringing other people into the mix, not professionals, other people, so friends, family, maybe a coach or a mentor, or even phoning up a helpline like Mind or something, or Samaritans, Samaritans are phenomenal, by the way, and I just want to stress they are not just for suicide, they're for mental health. A lot of people think they're just for suicide. Calling them up and just verbally vomiting, basically, just getting everything out there. And again, that can be really useful. The tier 3 is where you start bringing the professionals into the mix, whether that's NHS or private therapy, speak to your GP. There's kind of various different options out there. There's therapy with charities and stuff. And what's the beauty of tier 3 is that you can stay there. There's no need for tier 4. You can stay there until things are looking better. What I would say to people is write this down. Don't just think and then go, I'll remember that when it comes up. You won't. Write it down. I'll have it on my phone personally, and then wherever I go, if something triggers me, maybe a movie or a sound, that's one of the cool things about PTSD, is I pull my list out and go, boom, I'm going for a run. I'll see you later. And so I'll just go out and I'll work my way through. And like I say, I used to relapse about every 3 to 6 months over the course of 7 years. I've not had a full relapse now in about 4 years. And that is, I'd say, down to my care plan and probably my wife as well. She's pretty awesome. But she's there to support me as well. She knows what's going on. And again, that's really key. And I probably should have mentioned this before, is by being open and kind of telling somebody close to you what's going on, they can not only recognize it, but you then have permission to say, I don't feel good today. My head's really swimming. And they can say, okay, that's fine. Let's do whatever you need to do to help us. So yeah,
that's really interesting, because I know that often in coaching we'll talk about what's the help of a significant other, or how might you involve a significant other in the attainment of your goal or in your support. And I guess it's really important within this as well to recognize that somebody might come and talk to you as the coach, and you begin to open up, and there might be a conversation there about, well, who else can you open up to? Who else can you share this with?
Yeah.
That can help you and keep an eye on you and support you. And as a coach, is not to be afraid to go into that space, because that might be the thing that somebody really needs out in the world, is somebody that can keep an eye on them that isn't the coach. So we don't get caught in this codependent relationship with the coach and coachee.
Mm-hmm. Absolutely. I think, for me, kind of good communication with my wife has literally saved our marriage and probably saved my life. Not to put too fine a points in it. And just to pick a kind of a smaller example in that, anybody who's out there who's started a business knows that it's quite stressful. If I'm feeling stressed with work and I don't speak to my wife, she will pick up when something's wrong, but she won't know quite what it is. And if you can bring that out to the field of mental health, and stress is a component of mental health, where it can make you think, say, act, whatever, in a certain way. And if you don't share that with your significant other, they might often jump to assumptions like maybe they're annoyed at me, or this is happening, or whatever. But by doing that, that just adds clarity to the situation, and everybody knows what's going on. So yeah, I think certainly to have someone around where you can share like that is so important. And if it's not your significant other, find somebody in your life. If it's your coach, great. But yeah, it's so important.
It's been fascinating talking with you, Pete, and I know that we've had some conversations about perhaps creating something for coaches as a kind of a touch point for them to begin to think about how they might explore the challenges of mental health within the coaching itself. And I guess before we sort of sign off, is there anything that you would want to say to somebody, maybe about how you might begin this, or where you might look, or something that might be great to read around this?
Yeah, so there's loads and loads of resources out there. Some of the free stuff out there, things like Mind and Time to Change, really, really good websites. The NHS website, again, is full of useful information. And then, not to promote myself too much, but I do run mental health first aid courses, which is designed exactly for this kind of stuff. But just kind of get out there and just look and talk and kind of expose yourself to what is traditionally quite an uncomfortable subject for a lot of people. But by doing that, you not only give yourself permission, but also other people permission as well to be in that space, to explore it, and also permission for somebody who's suffering to openly suffer. I know that sounds awful, but openly suffering is much more preferable to suffering closed up and feeling alone. But yes, there's so many resources out there that, I can't even think of it.
well, I guess what we'll do is we'll put some links alongside this post for people to explore. And I think I really liked what you were saying there about, by talking about it, giving others permission to talk about it and allowing ourselves to openly suffer with something as opposed to inwardly suffer with it and have it sort of tear us apart from the inside out. So, is there anything you'd like to say before we close, Pete?
All I'd say, it kind of is for anybody out there who is listening and suffering, and the stat is 1 in 4 are suffering right now. So I guarantee there's somebody there is support out there, no matter who you are, no matter what you experience, and there is support. I promise you. What you're going through right now is temporary. It will pass, but it will pass much quicker with support. And lastly, I know we mentioned this before, but it's so important, is you are so much more than a label. Don't identify it as your condition. I used to do this. I used to wake up and not give myself permission to feel any kind of happiness or joy because I was depressed. Therefore, I had to be depressed. And lastly, don't ever give up. I've been there. I've been in those really dark places, and it makes sense to give up at the time. It does. It feels like it makes sense, but it will pass. I promise you, and it will get better. So just keep fighting and reach out to somebody.
Thank you so much, Pete, for being so open in sharing your own challenges and the work that you're doing. I think it's great that you're so open to share it, and I think it gives us permission to begin to think about it and to talk about it, and also to begin to recognize it within our own coaching practice, to then begin to think about, so how might I want to work with this? What other training might I want to do to develop myself as a coach to be able to push the boundaries of what I'm capable of whilst working within my own capabilities. So thank you so much for joining SP. It's been a real pleasure speaking with you, and I look forward to speaking with you again soon.
Thanks so much for having me. I really appreciate it.
Thank you. Take care.
I know.